Hello, and thank you all for joining today's COPSS-NISS Leadership Webinar. My name is Jennifer Bobb, and I'm an Associate Investigator at Kaiser Permanente Washington Health Research Institute and an Affiliate Associate Professor of Biostatistics at the University of Washington. I'm also honored to be a recipient of one of the 2024 COPS Emerging Leader Awards, which recognize early career statisticians for their leadership and impact. So first, I'll give a little background on COPS. The Committee of Presidents of Statistical Societies, COPS, represents leading statistical organizations, including the ASA, ENAR, WENAR, IMS, and the Statistical Society of Canada, among others. COPS sponsors several prestigious awards, including the COPS Emerging Leader Award, which celebrates statisticians who have demonstrated leadership and the potential for shaping the future of our discipline. This webinar series, co-organized by COPS and the National Institute of Statistical Sciences, NISS, is designed to highlight leadership journeys across different areas of statistics, offering insights from distinguished figures in our field. Today's session, Making an Impact on Public Health Through Statistical Leadership, will explore how statisticians can leverage their expertise to influence public health research, policy, and practice. Many of us are drawn to statistics and data science because of their real-world applications and the potential to create meaningful change in society. However, translating statistical insights into real-world impact requires more than just technical expertise. It also requires leadership, thoughtful decision-making, and collaboration. We are fortunate today to have two outstanding leaders with us who have used their statistical expertise to drive meaningful change in public health. So I'll give a brief introduction to our two panelists. Dr. Bhramar Mukherjee is the Senior Associate Dean of Public Health Data Science and Data Equity at Yale School of Public Health, where she is also the Anna M. R. Lauder Professor of Biostatistics. Dr. Mukherjee's research spans statistical methods for analyzing electronic health records, gene-environment interaction studies, data integration, data equity, shrinkage estimation, and the analysis of environmental mixtures. Collaboratively, she works across a range of areas, including cancer, cardiovascular diseases, reproductive health, exposure science, and environmental epidemiology. During the COVID-19 pandemic, she and her team developed statistical models and nowcasting apps to inform policymaking in India. And this work received worldwide media attention and was covered by many major media outlets like BBC, NPR, New York Times, Wall Street Journal, and the Times of India. She's also served on several National Academies of Sciences, Engineering, and Medicine consensus study committees, including the Committee on the Reassessment of the Department of Veteran Affairs Airborne Hazards and Open Burn Pit Registry. She's also received numerous awards, including the Gertrude Cox Award, the Adrian Couples Award, Janet Norwood Award, Sarah Goddard Power Award, the Carl E. Pierce Award, Jerry Sachs Award, and the Marvin Zelen Statistical Leadership Award. Our second panelist today is Dr. Thomas Fleming, who's a professor and former chair of the Department of Biostatistics at the University of Washington in Seattle, and is a member of the Fred Hutchinson Cancer Research Center. Dr. Fleming has led the development of state-of-the-art statistical methods for the design, conduct, and analysis of clinical trials. And he's also had leading roles on landmark trials, including a publication in New England Journal of Medicine on prevention of transmission of HIV, on which he was senior author, which was recognized by Science Magazine to be the scientific breakthrough of the year. He has chaired or served on data monitoring committees for more than 200 clinical trials, and for more than 30 years, he's served as a regular member of several FDA advisory committees and as an invited voting member on more than 100 occasions. Dr. Fleming has also received numerous awards, including the Outstanding Teacher Award from the University of Washington School of Public Health, the Ross Prentice Endowed Professor of Biostatistical Collaboration, the Ward Kate Spirit Award from the NIAID HIV Prevention Trials Network, the FDA Commissioner Special Citation Award for extraordinary contribution to the agency and election to the U.S. National Academy of Medicine. We are delighted to have both Drs. Mukherjee and Fleming share their insights with us today. So for the structure of the event today, each panelist will have about a 10-minute talk on their leadership journey, and will describe how they have applied statistical expertise to tackle public health challenges. Then after their talks, we'll move into a moderated discussion where I will ask a few prepared questions. And then we'll open the floor for audience questions. So please submit your questions via the Q&A function at any time. So now we'll dive into the panelist presentations, and we'll start with Dr. Tom Fleming.
Great. Thank you, Jennifer and Megan and Lauren, for coordinating this. Privileged to be here also with Bhramar Mukherjee. And so, yes, to kind of summarize what I would consider some of the highlights as I see it in my pathway toward attempting to make an impact in statistical leadership and public health research. I go back to my goals even as an undergraduate, when I was an undergraduate studying in Minnesota. It was to make a difference in the treatment and prevention of diseases in evidence-based medicine. And so it motivated me to think, well, I'd like to then have a meeting as an undergraduate with the University of Minnesota Medical School head to see whether or not maybe pursuing a pathway in medicine would be the proper approach. And I got some very sage advice, which is, if in fact I'm very much inclined as a quantitative scientist, don't apply to medical school, but rather pursue advanced training in quantitative skills, in my quantitative strengths, and then synergistically working with clinical colleagues, apply these strengths in research and teaching in areas of clinical medicine. And that was great advice. And so I then did pursue my PhD training in a more quantitative theoretical program. And through that process, I gained a lot of enhanced strengths in methodological research in areas that would be relevant to medical research, such as survival analysis. And I've always found that these theoretical foundations that I obtained in graduate school have been invaluable to me throughout my career, even though much of that career has been spent in a more applied area of clinical trials research. So in essence, then, my training was very theoretical, and yet I wanted to be very much involved in the applied side. And so after I received my PhD, I made a decision that even though I wanted to spend much of my career teaching in an academic institution, put that on hold. And so I spent 7 years at a leading institution in medical research, which was Mayo Clinic. And I chose Mayo in part because not only was Mayo excellent in clinical care, they had a great deal of emphasis on advancing clinical care through research and teaching. And so my goal then was to say, all right, I got a lot of the theoretical training in graduate school. I wanted to really enhance my learning on the art side. And so at Mayo, I remember when I first went there, I was assigned office space in the Department of Oncology. And I said, oncology? I wanted to do cancer research, which tells you how little I knew about the medical research side at the time. But one thing that I realized in my Mayo days is, as much as I wanted to be involved in teaching is very often is also done in a one-on-one manner. And so I had lots of meetings in those years with clinical colleagues in a one-on-one. And I made a decision early on in my career that I was going to be willing to admit what I didn't know. There were lots of things that I didn't know. Clinicians would be telling me about B cells and T cells. Well, teach me about that. I admitted what I didn't know. And in that manner, it set me up for being able to really efficiently and effectively learn a lot from my biological and clinical colleagues. But I also found that in those interactions, there were very significant quantitative insights that were very relevant for them to know. So it was very much a win-win experience where they taught me much more about the clinical and biology sides, and yet I had very much to offer back to them in terms of the quantitative thinking about how best to address medical research. So then after those 7 years then at Mayo, then I did go on to University of Washington, been privileged to be here now for 40 years. And I've been engaging in more of the synergy here by being involved in teaching and in research, and doing so quite broadly, even beyond University of Washington, bringing in experiences with other entities, doing a lot with National Institute of Health. And I'll talk more about that when we get into the Q&A about research, cancer research and HIV/AIDS research, but also working a lot with WHO. I've loved working with NIH, and yet public health emergencies and pandemics, you don't beat a country at a time, you beat worldwide. And so it's been wonderful from my perspective to be able to collaborate a lot with WHO in the Ebola outbreaks, in dealing obviously with COVID-19 and currently with monkeypox. And then working a lot also, not just with government sponsors, but with industry sponsors. And in that regard as well, I've been especially grateful for the time I've been able to collaborate with FDA as well. So I always say to my students, in medical research, you can get things done fast, right, and cheap. And as long as, but basically only 2 out of 3 are really feasible. So as long as right is one of the 2 out of 3, I'm happy. So government research in clinical trials in particular typically gets it done right and cheap, and industry gets it done right and fast. And yet when we're doing things in industry, getting it done right and fast, which is invaluable, what industry can contribute to this, I always tell my students and others, it's really important when you write the objective of your research to get the objective right. The objective is not to establish your experimental therapy or intervention is safe and effective. It's to determine whether. Please be objective, at least when you write the objectives. And in this regard, I consider my FDA colleagues my heroes in this whole process because they have such positive influence in ensuring that when we are getting it done right and fast, that the patient interests are really still very much stressed. When I teach my biostat students and stat students, to my way of thinking, I've mentioned to them there are 3 fundamental, critically important areas. One are the theoretical foundations, and that's hugely enhanced during your graduate training. But another is mastering the art, which is a lifelong learning process that should begin in graduate school, but it carries on throughout your life. And so in my clinical trials class, I have my students involved in not just learning what I've learned on the applied side of my collaborations, but working with each other throughout the course in developing a research project and developing a grant for a clinical trial where they're in a group of 4 people, 2 quantitative, 2 medical, to come forward with what would be the most appropriate research. And then oral and written communication skills. The classic example of this, as Jennifer mentioned, I've had the privilege of serving as a voting member 100 times on FDA advisory committees. Those committees are in place to assist FDA in understanding whether or not the research that has been done for treatment and prevention of diseases provides reliable evidence of efficacy and safety. That's the mission. There are 10 clinicians typically and 1 statistician on these advisory committees. And I've often asked my colleagues, why is there only 1 statistician? And one of my clinical colleagues giving me a hard time said, well, it's because the clinical aspects are so much more important. And I said, well, I always thought it was because it took 10 clinicians to have the same impact as 1 statistician. But on a serious note, communication skills are critical. Often you are the lone person on that committee that's a statistician. And it's really critically important for you to be able to effectively communicate. There's a huge unmet need in statistical leadership, especially in areas of clinical trials. CanStat, Canadian governments recognize this. They have now initiated a training program that's wonderful to enhance our numbers of young people training in clinical trials. That's a worldwide need. Biostatisticians need to have a seat at the front of the table. And if we don't, that's not entirely the fault of others. It's our responsibility to take that front row seat. And the last point that I'll make here up front is the other aspect of mine that I've been privileged to be involved in is in data monitoring committees. They safeguard the interests of trial participants, protecting the integrity of the trial. Susan Ellenberg, in a textbook that we wrote on data monitoring committees, had my favorite paragraph where it says, if you're fly on the wall and that committee has a clinician, statistician, and biostatistician, you know you're on a great committee when at the end of the hour, you don't know which is which. Which is, if you have a clinician, an ethicist, and a biostatistician, which is which? And it doesn't mean that the clinician doesn't have greater depth of insight clinically, ethicist and statistician in their areas, but we should be conversant with each other in knowing what those aspects are in each of those areas to be able to effectively work together. Training the next generation is critical. Didactic and apprentice. We talk about it's not just reading books, it's actually being involved in the experience. I've often said if I went up on a small plane with Bhramar and she was the pilot, I would want to know that she hadn't just read books about it, that she'd actually been up with instructors before. And that's very much true on data monitoring committees, which is another reason we shouldn't always have just one biostatistician. We should have a collective experience, but there should be an opportunity for those without experience to be engaged with those who are. I'm going to pause now. There are other issues as well, but I think a lot of that will be covered in the Q&A. So thank you.
Thanks so much, Tom. That was a great overview. I'm looking forward to hearing more at the Q&A portion. So now we'll turn to Dr. Bhramar Mukherjee to talk about her leadership journey.
So I am going to be actually predictable, and I am going to use some slides. And so before I begin my presentation today, I just want to take a moment to thank COPSS-NISS for this brilliant webinar. And in particular, the COPSS Emerging Leaders and the COPSS Leadership Academy. I feel so proud of that because this was one of the initiatives that I really pushed forward and launched as the COPSS chair from 2019 and 2021. And my colleague, Judy Wang, and I were really determined to launch these new set of awards. And it's so wonderful to see this group coming together and so many people from diverse background and leadership talents being recognized. So really, really feel very grateful for that moment, for this journey. So I want to say something about leadership. And I think that my pathway to leadership has been quite roundabout and convoluted. I wanted to share a bit of that. But I want to start this moment, as I said, with gratitude that we are standing here as a profession in terms of biostatistics because of the generational work that has been done. And we can see that in the work of Dr. Bob and in the work of Dr. Fleming, careers spanning over decades, contributing to different realms and different domains of statistics, biostatistics, and public health. I have to say that for the past 3 weeks, I have been feeling very down and out because I do think that I believe in public health, and it has been a defining moment for public health, a critical moment for public health, where some fundamentals and foundationals that we believe in are being challenged. But I do see public health not just about vaccines, not just about clinical trials, but really an overarching principle for social and global solutions. 21st century public health is really whole human and planetary health, and I totally believe that. And it has come to my rescue as a scholar and academic, and I want to share that story, how I found public health and public health leadership. But in these moments of distress and despair, sometimes you have to look for art and humanities instead of science. And I'm a very big literature and theater fan. And so I want to really think about my work. And as we are standing in terms of benchmarks, whether our grants are going to be canceled, what will happen to our indirect cost, what will happen to universities and higher education, I really want to go back to a question that one of my favorite characters, Mikhail Astrov, in the play Uncle Vanya, asked that, will those people who live after us in the course of 100 or 200 years, will they remember and speak kindly of us? I want to really hold ourselves as leaders to that ultimate benchmark. So I love public health as a biostatistician, as a statistician, because it really gives us an overarching paradigm to understand the biology of health, not just disease, the biology of human health, human wellness, and human flourishing. And from cells to society, how can you collect data at different levels? And how do you understand the variation in data and think about, once you understand that variation, you can advocate for change and intervention, integrating different domains of variables, physical, mental, emotional, social, and cellular level data. And all of us work on different pieces of data. And then finally, we integrate that to understand and advance science. So I want to really think about two things I want to share with you: my leadership journey and how I found public health. And it was a lot of random events. And then I want to talk about lessons I have learned. Of late, I have been reading a lot about how to bring my authentic whole self to leadership, to my work. And obviously, all of us in this virtual room have had a different path to come and arrive at this moment. So I do not want to ignore that I was born in India, and in 1996, I came to the United States for higher education and for a better life. Um, and then I want to recognize that hyphenated identity and the quest of an immigrant scholar as I aspire leadership, because my leadership journey for someone with a name looking like mine, speaking like me, with a food habits like me, it's not the same as someone else in this room. So I want to show you that when you come to a different country, you actually give up a lot of your cultural identity, your comfort food, the language that you were used to seeing around, the language that you are used to speaking, your parents, your family. And the fact that you are different can be also a barrier in aspiring leadership in a country where you did not grow up. So I want to sort of think about that, how to bring that authentic self to leadership. So as I mentioned, I grew up in Kolkata. I really loved mathematics and studied statistics and mathematics all my life. And then so far, as you can see, I did applied statistics, I did mathematical statistics, I did PhD in statistics from Purdue, but there was nothing about public health. So my first moment in terms of leadership was actually as a graduate student, as an international graduate student, looking at role models. And I am very, very thankful for two role models I had at Purdue, Professor Mary Ellen Bach, the first woman chair of Purdue, and then a trailblazing assistant professor at that time, Professor Rebecca George, who is now, after being dean at Carnegie Mellon, is the provost at RPI. And they have been really a steadfast advisor, advocate, supporter, mentor. And I really want to recognize the role of sponsors and mentors as you aspire any kind of leadership. And I do think that leadership and networking actually carries with you. And this is my graduate student cohort from Purdue. I'm going to say that we have graced age very gracefully. But then when I first became a statistician, my first job was not in public health statistics. It was in the statistics department at University of Florida. And I have to honestly confess that I was a complete disaster as an assistant professor. I could not really get my act together. My thesis papers were rejected. They were published in low-tier journals. And I recognized that my thesis in stochastic process and probability was not who I am. And at that moment, I think I did the first leadership decision, leading myself into a new area, which was much more epidemiologic methods and use of statistics in case control studies and public health. So once you pivot to a new area, there are dangers if you don't like your dissertation. Then your first few years as an assistant professor are terrible because you don't know this area. You are studying a new topic, but there is no evidence in your CV. And George Casella, very famous George Casella of Casella and Berger, was my chair. And every annual meeting with George was a nightmare. And George will tell me that, Bhramar, you seem like an intelligent person, but there is no evidence on your CV. And I'm sharing this because many of us do not start with success, do not start with a brilliant future, or even, I really highlighted these words, struggle, nightmare. My NSF grant proposals were rejected 6 times in a row. So forget about career award, just getting a basic grant was difficult for me. So something happened when I moved to Michigan Biostatistics. I think that public health, the way the data can whisper stories and you turn them into equations and model, that really rescued me because I found my motivation, I found my purpose. I really enjoyed translating the science into the language of modeling and blending methodological research interest with collaborative projects. And so this is what Austin Bradford Hill has said, that permeation of statistical research with experimental spirit. And I am so eternally grateful to Michigan Biostatistics because I have had such wonderful leadership opportunities there. And I have highlighted some that I started as an assistant professor in 2006. And when I left University of Michigan, which is still hard for me to say, I was an assistant vice president of research and was the first woman chair of the Michigan Biostatistics department. And I just want to highlight some of the different spheres of leadership to say that leaders do not have to be a certain way. Leadership does not have to be in a certain way. You can aspire for leadership in education, in collaboration, in your own research. There are various forms of leadership. And at different phases of your career, you actually contribute in different spheres. But if you ask me, what is your best leadership contribution to public health, is actually starting this summer program that I have led for the last 10 years, training 357 undergraduates over the last 10 years. The program, the first iteration is going to happen at Yale this summer. But these 357 students did not know about biostatistics or public health. They're extremely talented in coding, in mathematics, in statistics, but the connection with human health, that magic that happens, that is a transformative impact. And the summer institutes in biostatistics across the nation have contributed so greatly to public health leadership and growing the next generation of public health leaders. So this I consider is to be my most important public health leadership, not research, not administration, but actually leading this summer program. Another one I want to mention, both Tom and I have spent a lot of time working with our colleagues in cancer. And I had the opportunity to lead as an associate director that the Division of Cancer Control and Population Sciences at our Rogel Cancer Center. It was leading 72 members from 25 departments across University of Michigan, coming from 6 different schools. 5 of them were statisticians, mostly MDs, about 10 only PhDs. So this was really walking through fire as a statistician. That why would you lead cancer control and population sciences? What do you bring to the table? As a statistician, your PhD was in stochastic process. What do you know about cancer? So to convince that group, so I want to say that pictures are always very important. And so when I first started, the group was a little like, I would say a little adversarial. They did not really trust me. It was not my tribe. But by the time I finished, you can see that they were, and in this picture, there are like scientific innovators and lead cancer researchers. We all sort of vetted and believed in big data and methods and the importance of statistics. So this is something you can do if you take cross-disciplinary leadership to convince and convert people into believing in the contribution of statistics. I want to say a little bit about the leadership in Michigan Biostatistics, and I'm very passionate about leadership of women in statistics, biostatistics, and public health. And so Michigan is a great department in 1949 to 2018. And this will always be a remarkable moment. And those of you who come from a non-traditional background, I want to quote from Janet Norwood, that women do have to take advantage of opportunities presented to them. It often isn't quite as straight a career path as it is for men. So as chair, obviously you have to keep the trains running, but you also have to create new directions and destination. So at Michigan Biostatistics, one thing I realized that I'm a statistician, numbers should be a big part of my leadership. So every meeting with a dean or a leadership, I'll walk into with these numbers, that this is our numbers in 2020, this is 2021, this is 2022, in terms of research, in terms of faculty awards, this one-page summaries, which are convincing to get resources. I'm incredibly thankful and proud of the Michigan Biostatistics department and what all of them contributed to public health, the students, the staff, the faculty. During my time as chair, the department grew a lot, and leadership is really about getting more people in a field that you love. And these are all the faculty that I was very fortunate to hire as chair. The students, the number of students, the master's program, the PhD program, both grew really substantially. I'm not going to show rankings of Michigan biostatistics because I do not want to induce competitive environment. But at the same time, I felt very committed to the profession of biostatistics. I really believe in biostatistics. I love biostatistics. So I've contributed in various ways to COPSS, to NISS, and as I'm looking forward to my term as president of INAR. But also in terms of editorial services, as I said, that at different parts of your life, you contribute in different ways. But I have to say that leadership really requires lifelong training and commitment, be it research leadership, be it administrative leadership. And I did a very substantial program for executive leadership for program for women in academic medicine, and also public health is a part of that program. And I always thought that as a leader, my job was to really serve the faculty, the enable, empower, energize, and enhance the members of my community. You have to be extremely efficient, but there is something beyond administration. There is a touch of creativity that you can bring to any community at a school, institution, national, global, or an organization level. And I look forward to that. I cannot conclude without mentioning the two most significant research public health leadership that I'm incredibly fortunate to be part of. One was during COVID-19, and again, recognizing and respecting my hyphenated identity, I launched this group of scholars from all over the world, the COVID-19 study group. And we modeled the pandemic in India from for over 3 years almost. And we started in March of 2020 through a Medium article. And that one of the fascinating things about science and life is that you never know. A Medium article is going to lead to a 3-year-long, very long media story. And we can talk about that during Q&A. And again, Debashri Roy, another assistant professor then at Johns Hopkins, was my collaborator and co-conspirator in that process. This Medium article and this work, which is not going to my CV as papers, it's a lot of public communication, a lot of writing, has the impact that none of my rest of my papers put all together will have. This is something fascinating about science. I'm also incredibly proud to be the PI of a cohort of 100,000 participants. It's not easy for biostatisticians to be part of data collection. This is the MyCares, or Michigan Cancer Research on the Environment Study. This is a statewide cohort with 25,000 white, 25,000 Black, 25,000 Latinx, and 25,000 MENA population recruited from environmental injustice hotspots at Michigan. So I think that what worked for me as a leader is extreme planning in terms of my time, what resources I have, and how I'm going to map the resources to priorities, because there is not abundant resources. The second bullet point may sound like a computer science paper, but fairness, trust, transparency, and accountability are very important. Support from your community and student staff, outstanding mentors and sponsors, and taking sabbaticals and many vacations. Sometimes you just have to take vacation in order to come back to public health and in order to come back to leadership. I want to conclude on the note of coming back and growing the careers of others. And I was very fortunate to have two really strong associate chairs in my last 3 years, Professor Lou Wang and Professor Kelly Kidwell. At one point of time, your success is only measured by the success of others. And I truly, truly believe it. I moved to Yale 6 months ago, and I am seeing for the first time, one of the reasons I moved to Yale is that for the first time in my life, I wanted to work for a female boss. And on the left-hand side, you can see our trailblazing dean, Megan Rainey. She is leading a new independent school of public health, but many faces of leadership coming from many cultures that's what we celebrate in academia. That's what I celebrate as an immigrant scholar in the United States. And in my role, I want to advocate, I want to characterize, I want to give definition to data equity or the data struggle of the unseen. Who are we missing in our scientific studies? Thank you very much, and I look forward to the question and answer. Thanks.
Thank you so much, Bhramar, for those inspiring words. So we'll now start our Q&A portion of the session. If you have your own questions, please do enter them into the Q&A function. But to get started, you both talked about many different pieces of work that you've been involved with. And one of the things that I find difficult is figuring out what to take on and what to say no to, because we're often have a lot of opportunities. So I was curious if you could share a bit about what factors influence your decisions on which projects to take on and which opportunities to pursue for service and teaching, as well as for research. And I was also curious if your decision-making process has changed as you've progressed through your career. Tom, do you want to go first?
Okay, sure. Well, Dr. Mukherjee's experiences are inspiring. Inspiring about the importance of having the courage to pursue new opportunities and challenges. And by the way, hang in there in spite of the last few weeks. We're going to come out. And basically, a critical principle here is the benefit of diversity of engagements, is having a diverse contributions. And so when I'm looking at research, I'm looking at it as, is this a collaboration across disciplines, across diverse experts that would be involved? Is it research that will address questions, research questions that will truly make a difference in healthcare? And then in my area, are we looking at well-designed, well-conducted, well-analyzed clinical trials? So as I'll talk about when you get to your next question, Jennifer, one of the areas that I've been involved in is HIV/AIDS research. And I had the opportunity for 20 years, from 1986 to 2006, to serve on the data monitoring committee for the Division of AIDS at NIAID for the conduct of clinical trials for therapies for HIV/AIDS research. And so these were 50 treatment trials that I was involved in. And we got about 5 years into this process, and Division of AIDS leadership said, Fleming, when are you going to get involved in actually leading some of this research? And I said to them, as soon as you do prevention trials, count me in. And in 1993, they did. They then began the HIV/AIDS, HIVNet, and the HPT and HVTN clinical trials for prevention. And as important as treatment is, and it is very important, my sense is in impacting diseases, there's such an incredible opportunity through prevention research. So from my perspective, I'm looking forward to being involved in broad areas. Show me the area, show me the problem. I'm interested. But when I have a chance to actually have my choice, I very much have been rewarded by being involved in prevention research.
Yeah, so I think that I always think about the team and the people that I'm working with. That's very, very important to me. And that has been a constant factor as I decided which project to work on as an assistant professor till today. And I think one of my senior colleagues at Michigan said that life is too short to work with people that you don't like. So I think that really is a principle that I carry. I also have realized that there are 3 types of people who are like jobs, careers, and calling. People who take job as job, career as a milestone of progressing, and calling. You are working because you want to know the answer. You're working almost for yourself because nobody is really asking you to do that work. So I work well with people whose work is their calling. And I have to say, I have to be very honest that when you're an assistant professor, sometimes you make convenient choices that you know that something very ambitious or something that you want to do may not be feasible, but you have to sort of get it to that point. So sometimes you make some compromises. So for example, I'll just give you an example. The summer program, which I think has been my biggest contribution to biostatistics, I wanted to start that as an associate professor, and I went to the departmental leadership, and I was told that if I focused too much on education, I would not be taken seriously as a researcher. So I listened to that, and the moment I became full professor, I did what I wanted to do. So sometimes you have to make some compromises in order to choose your project, but gradually over time, I think it changes. And I truly believe that tenure is not to play it safe. It is to take risk. That why should we not let go and do what we like? And I think we need to do better at normalizing failures so that we can take those risks in terms of taking high risk projects that, yes, the probability of success is low, but then we try. And so I think that as I have moved on, I get tremendous joy to see that my work or something that I did, even writing a grant, enables the work of others. And that has become very important in any project I choose.
Thank you. So we already heard a little bit about some of these in your opening remarks, but I was wondering if you could share examples of projects or roles that had unexpected or particularly meaningful impacts, or if you feel like you already shared that, if there were challenges that you experienced when trying to conduct impact-driven work and how you navigated those challenges.
Should I jump in?
Sure, yeah.
Thank you. So great question in terms of where did the research have unexpected or particularly meaningful impact? And I'll give the illustrations here from my HIV/AIDS prevention research that I was mentioning that I did get involved in after 1993. And a principle here that I'll talk about is the critical importance of doing that research with the community. We're not coming in to tell what to do. We're working with the community and developing a sense of trust. And so examples of this, I was serving on the data monitoring committee for the first breakthrough trial that we had in prevention of HIV transmission. And that was the ACT, AIDS Clinical Trials Group 076 study that we monitored in 1993. And it was looking at an intensive course of AZT. In mother-to-child transmission of HIV. And we stopped that trial with success when there was a 2/3 reduction. And that was a major benefit. But 4 years later, 1997, while now in upper middle income countries, this was standard of care for pregnant women with HIV infection. Much of the prevalence of pregnancy with HIV infection were in lower middle income countries where nothing was available. And so our goal was to make a difference in the world where it mattered the most, which is where the risk was the largest. And so we went to Kampala, Uganda, to do a trial of single-dose oral nevirapine. These mothers aren't under care for throughout the second and third trimester pregnancy. They come walking down from upper countries without home addresses to Kampala, Uganda, to Olmalago Hospital to deliver. And so our regimen was a single oral dose of nevirapine to the mom at delivery and a single oral dose to the infant. How do we compare that? Do we compare it to the intensive AZT regimen that's not feasible in Uganda? Some said, well, you can't randomize to nothing. And our argument that we strongly believed is that it's critical when we're conducting clinical trials that we're answering questions relevant to the settings where the participants are in those trials. Distributed justice. So if we're doing a trial in Uganda, we need to answer a question relevant to participants in Uganda. And so our control regimen has to be a version of standard of care. If we had done a trial where we gave short course nevirapine in addition to intensive AZT and compared it to AZT, that was actually done. It was ACTG 316 done in a developed country setting where that question was relevant. And the answer was it had no effect. And that's because the infections that were still occurring were occurring prior to labor and delivery. So nevirapine had no benefit. But the trial we did, which was with NIAID, which was HPTN, the HIVNet 012 trial, randomized with standard of care being short course AZT, which was achievable in Uganda, And we looked at adding single dose nevirapine to that. And it was a remarkable result of a 50% reduction in transmission that gave us the opportunity for the first time to get antiretrovirals into lower middle income countries to be able to prevent that transmission. And then moving forward, looking forward at preventing transmission, 6-7 years later, in 2005, we still were not able to get antiretroviral therapies to lower middle income countries for infected people. And even though we had proven at that time, by 2005, that we could take a fatal disease and turn it into one where you would have full life expectancy. If you were in Africa, if you were in South America, you weren't getting access to these interventions. So we did a trial called HPTN-052 that randomized participants from Africa predominantly and South America to antiretroviral therapy given earlier in the disease versus later in the disease. And the goal of the trial was to determine whether that antiretroviral therapy didn't just protect that person who was infected to allow them to live lifelong, but to determine whether you could prevent transmission to their partner. And the results were stunning. If you treat an infected person with HIV, not only are you benefiting them, it was a 95% reduction in the risk of transmission to their partner. That changed the world. Now people were willing to say, we do need to treat people in lower middle income countries because it's not just helping them, it's preventing the spread of the disease worldwide. And as Jennifer mentioned, I'll never forget, it was December 24, 2011, getting a message from Science Magazine, where Science Magazine every year looks at all of science, aerospace, physics, chemistry, medicine, and says, what's the most important breakthrough this year? And I was a senior author on that article where this study was determined by Science Magazine to be the most important scientific breakthrough of the year. So it was possible, though, by the collective efforts that were made with the communities in these areas. The HivNet 012 trial, the HPTN 052 trial were done with major community leadership from lower middle income countries. So we developed a sense of trust with these communities, that our goal was to do research that mattered to them. And we designed the trials in ways that the answers were not going to be answers that we need to know in the US. It's answers that participants in these lower middle income countries needed to know for their benefit.
Thank you, Tom. That was inspiring to hear about how that had such a big impact.
And also, I have to say that's so inspiring because there's a lot of resistance, a lot of skepticism. That whole period is sort of really inspiring how people showed resilience and belief in science. Ultimately, the arc of science is finally pointed towards the truth. And this is an incredible story. Thank you for sharing. It's just like giving me goosebumps. So for me, I think unexpected things that I have to mention the work on India, because I'm not an infectious disease epidemiologist. And why did we start modeling the pandemic in India? It was because, again, I saw a lot of lost eyes in students from South Asia looking at me when the stay-at-home orders started and all the flights closed down, and we are having this sense of loss that we are never going to be able to go back to our countries, see our parents. So it was almost started as a way to keep the community, them together, that what can we do? We cannot, our colleagues were frontline health workers and working in the hospital as public health statisticians. What could we do? We could start modeling, and maybe we'll not do the best job, but we'll do an okay, good job, and don't let perfect be the enemy of the good. Did I know that that will lead to this incredible media involvement? And I was not prepared for that. And so over the whole course, there were so many moments where it was unexpected, because you will say something, particularly, how many people died of COVID is a contentious topic everywhere. And you'll come up with excess death estimates and you'll speak about that. And then there will be tremendous political backlash. And I was not prepared to do that, prepared to really feel comfortable with that. But I have to say the university's media office and also the leaders really were helpful and very supportive in terms of speaking your science and stay on course with respect to what you want to say. But I have to say that 2 years ago, I was sitting in an airport in India, and then two elderly people came to me, and I said that, like, they asked me, is your name so and so? And, you know, statisticians are not used to be recognized in public because we work behind the scenes. It's because of all of the television interviews that I had given. And so they said that I just wanted to thank you because we were following your model and taking the prediction from the app to decide when to travel and go see our children. And so being a math major who really did not care about people, and I felt much more comfortable in a solitary room with pen and paper to see the impact of the world, that the impact you can have with your math and modeling through public life and the trust you earn. And so that was very, 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 very grateful and completely unexpected from the moment we started that modeling to that moment. So you cannot really always do the calculation.
Thank you. Yeah, it's, again, very inspiring to hear about doing something that maybe wasn't something that was expected to be working on, and having that have that impact where you're approached on the street and people are using that for decision making. So I wanted to ask about if there were emerging trends or areas of statistics or data science that you think hold the greatest potential for public health impact, and how can statisticians position themselves to contribute to those areas?
I can't lose this opportunity to continue to advocate for clinical trials. So biostatistics continues to emerge as it should, and we are in our field getting into very exciting new areas of artificial intelligence and causal inference and many other aspects that are very important. At the same time, clinical trials remains an incredibly important area. And there is continued, as there should be, an increase in the design and conduct analysis of clinical trials for understanding how better to treat and prevent diseases. I always say the best way to deal with things is evidence-based medicine, and clinical trials are critical to that process. And yet we're now confronting a growing shortage. The Canadian government, I think I alluded to, has set up a program called CANSTAT. And CANSTAT's intentions are to be proactively doing our best to train more statisticians to be involved in clinical trials. And I've said, and it's been a privilege, I've done a lot of pro bono work to support that effort. And I've told the Canadian government, you're wise. This isn't a problem just in Canada. It's a problem worldwide. And I would strongly encourage those that are online, if you're thinking about areas to be involved to make a difference, I would hope that you would seriously consider this. One of the aspects of this that I alluded to, I'll just very briefly allude to it again, is data monitoring committees in clinical trials are a very important area of leadership for biostatisticians and clinicians. And these committees are made up of both. And we need experienced people on these committees. And yet, if you form these committees only with people that have DMC experience, you're not going to grow that group. So I come back to this issue again. Why should we always have only a single biostatistician included on DMCs? At least some of these should have two, where they're both full members, but one comes in with experience on DMCs, one without, and through that process, the apprentice process. So again, when I go up on that small plane with Dr. Mukherjee, at least I know that she's had an instructor teaching her. Similarly, if I'm going to be on a monitoring committee, it's great to be in with someone else who's been on it, even though I'm a full contributing member. So that is a specific area within clinical trials that I would that I continue to encourage biostatisticians to be involved in that DMC process. And I'm hoping we can set up processes to engage you, even if you haven't had prior experience.
Yeah. So we hear this pilot analogy. I may have an AI co-pilot and dare to take you on a plane someday. But I wanted to mention that as we are talking about, obviously I'm not a randomista, but I wanted to talk about the importance of causal inference and experimental design. I do think that there is a lot of information in real world heterogeneous data, particularly when COVID happened, right? There was no time to do studies, and we are really looking into the electronic health records to identify who is at high risk of COVID-related severities and so on. Immediacy, the action is happening in electronic health records and real-world observational data. So we need better principled methods of how to do valid inference. I want to say that we really need to focus on data integration, because multimodal data, structured data and unstructured data, how to jointly analyze them and what are the tools. And some of the obviously machine learning and AI tools are very good in terms of putting this data together. We need the computational bandwidth, and many times we shy away because we are not really so well versed with multiple types of data and so on. But I think that that's where our education needs to go, where we can combine our rigorous principled inference with very massive heterogeneous data, and do not shy away from leading large-scale data analysis projects. And I think that's incredibly important. I want to say that design, experimental design and survey sampling, where are data coming from? Statisticians are uniquely trained to ask that question, that not just think about y given x, right? Like, where do y and x come from? Our job is not just to predict, but to prevent. In order to prevent, we really need to understand where the associations and signals are coming from, and that for that, thinking about measurement error, thinking about information bias, selection bias, confounding bias, this is incredibly important. And I feel that we have a unique talent to bring to the table in terms of design and inference there.
Thank you both. We do have a question in the Q&A. I'll ask that, and then I have one final question, and then we'll wrap up. So the question in the Q&A asks, what do you think about the involvement of statisticians in documenting the impacts of war and conflict? And how would you go about it if you got a chance?
Bhramar, your thoughts?
So I think that I have always believed that if you feel passionate about advocacy and using your science to understand a problem better, I think that I think our field is we are so blessed that if you're interested in actually a topic, we can use our skill set to formulate questions and contribute to that field, because we have those cross-cutting tool sets of getting evidence from data. And I do feel that if that is a field where someone feels that they wanted to contribute, there are many, many interesting problems that you should contribute. But I don't feel I personally am qualified to talk about the specific problems and the techniques that are relevant there.
Do you have anything you'd like to add?
No, I think that's a great thought.
Thank you. So for our last question, I was wondering if you had any additional advice for early career statisticians who are inspired to make an impact on public health, and if you had specific courses or training program or professional experiences that would help prepare people if they're really wanting to do impact-driven research.
Let me add to that. You had another question, Jennifer, that we're not going to be able to get to, but I really would like to fold into this too, and that was, what's the trade-off? You had also asked about pursuing high-impact work, the trade-off between professional and personal goals and how to deal with that. So let me kind of fold in that question as well into this. So first of all, taking on the professional and personal aspects, in my sense here is that both of them are extremely important, that as we live our lives, we are committed to what's important professionally, but it is also very important to, we value our personal time and our time with families. And so my approach to that has been to dedicate, as I best can, all of my non-professional time to be spending it with family and community. And when I think about what we do professionally that makes such a difference, it's recognizing that we work together in a synergistic way professionally. The principle that's so important professionally is collaborating with diverse groups in ways that synergistically allow us to do the best. And so in my life, what I've tried to do is to spend my personal time following that same principle. I have 4 kids. And so, and soccer is a great sport where it's a collaboration of people. You don't have to be an athlete. You don't have to be a super player. We can put you on the field. Everybody can contribute. What you do together makes everyone better. So what I've done in my career is do the best I can professionally to create the best research in a synergistic way, and then to spend my personal time. I've coached 60 soccer teams over the year. So while I've taught 1,000 students about how to do clinical trials, I've also taught hundreds of community kids about how to work together to do things that we can do better together, where everybody then feels that they've accomplished and they're contributing. So to my way of thinking, it is important to be thinking not just about what we do professionally, but to be maximizing quality time on a personal level, also on a family level. From that second part of the question, which is, do we have advice for statisticians? My sense is, I come back to, we are in biostatistics very much benefited by the theory, the art, and the communication skills. All of them are incredibly important. And so please do build the theoretical foundations, but please do take advantage of the opportunity in the art. And I mentioned my clinical trials class, where the students spend the entire quarter in groups of 4, heterogeneous by discipline, developing a clinical trial and then defending it at the end of the quarter. So they actually have the experience of what is actually what they will encounter in actual practice, the art side of the science of being a statistician. And my last thought is, from my perspective, thank you all for this session. It's a privilege for me to have been part of these interactions here today with our attendees of the presentation. The thanks, in my perspective, the thanks go to you, the attendees, because you're our future. So thank you all for attending this. And we look forward to your leadership going forward in how statisticians will impact public health.
I could not say anything more. That's really inspiring to think about the future leaders. For junior faculty, and as a chair, I always said that there will always be a lot of advice, but sometimes you also have to learn how to go against the advice and pursue your own dreams. Make sure that what you are doing, certain people know your story and can support and champion your stories. And many times we get into too much of metrics. And as soon as you get into the pipeline, we start giving you, this is the number of papers, there are a number of grants, but not everything is metrizable. And I think it's important for leaders to support those dreams and those inspirations. And there's a healthy dose of, like, calculus plus a healthy dose of dreaming. And I feel like we probably are taking a lot away from the junior emerging scholars and leaders saying that this is a recipe for promotion. And I do not believe in that. And in my role as chair, I always have this conversation with junior faculty that if you want to pursue this, please do have this combination of a story, of a portfolio, but do not give up what you are really passionate about. So again, bringing your authentic self to work is very, very important. If you love something, also pursue that. Don't give that up. Or life is not all about work. Every evening that I am not working, and there are many evenings I'm not working, I am in a theater or in a concert, because art and literature and performing arts in particular gives me that joy and that really replenishing my soul. And I think that's very important, to hold on to those things that you love, but also bring a touch of that to your leadership style. So maybe your course can use a little bit of drama, or you actually do a video to promote your work. So bring those different whole self to work. And don't be afraid, don't shy away from being the holistic human you are and contribute to society as a statistician and also as a human being. And I wish everyone on the call all the best. Happy to help or discuss at any of the meetings. This is a wonderful community. I feel very blessed to be a part of statistics and biostatistics and part of this really graceful and smart and dignified community.
Thank you both so much. To our panelists, Dr. Mukherjee and Fleming, for sharing your time, insights, and experiences today. I also want to extend my gratitude to Jingyi, Jessica Lee, Amita Manatuga, Lauren Crawford, and Megan Glenn for their work behind the scenes in organizing this event. If you found this conversation helpful, please share the recording with colleagues who may benefit from these insights. And stay tuned for more webinars from the COPSS-NISS Leadership Series, and we look forward to seeing you at future events. Thank you all and have a great rest of your day.